Have you ever tried to give directions in a new city without knowing which way is north? It's pretty much chaos, right? Well, the human body, it's way, way more complicated than any city. So how in the world do we create a universal map for it? All right, let's dive into the one fundamental concept that really underpins all of modern medicine.
No, really, think about it for a second. If a patient is lying on their side, what does up even mean anymore? Is it toward the ceiling, or is it toward their head? And what if a doctor in Tokyo needs to read a report from a radiologist in, say, Toronto? How can they be 100% certain they're talking about the exact same spot on the body?
You see, without some kind of universal standard, simple words like up or down become totally dangerously ambiguous. And this isn't just some academic puzzle. We're talking life and death here. A miscommunication could lead to surgery on the wrong site, a misdiagnosis. You get the idea. We absolutely need an anchor point, a true north for the human body.
And that brings us to the brilliantly simple solution that solves this massive problem. It's called the anatomical position, and it's the universal reference point for everybody, everywhere. No exceptions. Now, the key phrase here is standard reference posture. What this means is it doesn't matter how a patient is actually positioned. They could be lying down, standing on their head, whatever. All anatomical descriptions refer back to this one specific stance. It's a fixed, universal standard that never changes. So let's kind of build this position from the ground up, shall we? First, the person is standing totally upright, or erect. No slouching, no leaning. Their head is level, looking directly forward, and their eyes are looking straight ahead. Just picture a soldier standing at attention. Okay, next up are the arms. And listen up, because this is a really crucial detail. The arms are just hanging at the sides, but, and this is the important part, the palms don't face in towards the legs like they normally would. Nope, the palms face forward. And when you do that, it automatically makes the thumbs point out, away from the body. This little detail, it's absolutely non-negotiable. And finally, we've got the lower limbs. Pretty straightforward here. The legs are straight, feet are flat on the floor, either right next to each other or just a little bit apart, with all the toes pointing directly forward. And that's it. Simple, precise, and totally universal. That is the anatomical position.
So you might be wondering, why go through all this trouble just to define one specific way of standing? Well, it's because this standard position unlocks an entire language of precision. It creates a whole new vocabulary that everyone in medicine can use. So instead of saying front and back, which, as we've seen, can be kind of confusing, we use the terms anterior and posterior. This means that no matter how the body is twisted or turned, the breastbone is always anterior to the spine. It's a permanent relationship, all defined by that standard position we just learned. And this new language, it extends in every direction. Superior just means towards the head. Inferior means towards the feet. Easy enough. Medial is anything towards the body's imaginary midline, and lateral is away from it. Then for our arms and legs, proximal means closer to the main body, or the trunk, and distal means further away. So your elbow is proximal to your wrist, but it's distal to your shoulder. See how incredibly precise that is? No room for error. And this sentence right here, this perfectly illustrates the power of these terms. This is a simple, undeniable anatomical fact. The heart sits closer to the body's midline than the lungs do. Any medical professional, anywhere on the planet, understands that sentence perfectly, with absolutely zero ambiguity. Now, the standard position also lets us do something else really cool. It allows us to visualize the body in these distinct sections using what we call anatomical planes. Just think of them as invisible sheets of glass passing right through the body. Okay, there are three main planes to know. A sagittal plane slices the body vertically into right and left pieces. Then you've got the coronal plane, which also runs vertically, but it divides the body into front, or anterior, and back, or posterior parts. And finally, the transverse plane runs horizontally, dividing the body into upper and lower sections. Kind of like a magician's classic trick of sawing someone in half. So look, this is way more than just a memorization exercise for first-year med students. Let's get into the real-world payoff and see why this one single concept is so critical in everyday healthcare. The shared language is, and I'm not exaggerating, the bedrock of clinical practice. It's what allows a paramedic to describe an injury with perfect precision to an ER doctor over the phone. It's how a radiologist can pinpoint the exact location of a tumor on an MRI for a surgeon. It's what physiotherapists use to describe every single movement. It is, quite simply, the foundation of clear, safe, and effective communication in medicine.
So when a medical pro says the pain is on the anterior aspect of the knee, there is zero confusion. It means the pain is on the front, not the side, not the back, the front. And that precision makes sure everyone is on the exact same page, which leads to better and much safer treatment.
The anatomical position is this powerful, almost invisible standard that brings order to incredible complexity. And it makes you wonder, doesn't it? I mean, from the standardized time zones that we all use to coordinate our lives to the very grammar that structures our sentences, our whole world is built on these agreed-upon reference points that we hardly ever stop to think about. So, what other invisible standards make your own world work every day?